Hello, and welcome to today's episode of the GynoBits podcast. I'm your host, Dr. Susie Weber, board-certified gynecologist and menopause specialist. On the GynoBits podcast, we'll cover women's health issues with a focus on menopause, vulvovaginal conditions, and sexual health. Hello, everybody. Today's topic is one that's a little less talked about during perimenopause and menopause, but it's one that I hear regularly from my patients, so I wanted to discuss it today. And that is how our body's natural scent or odor can change with perimenopause and menopause. And this also includes the sweating and perspiring and types of sweating that occur more frequently in perimenopause as well. And unlike hot flashes and night sweats, this is not a complaint that I'm going to hear from my patients 5 times a day, but I definitely hear it frequently. And personally, I can relate to changes in natural body odor with perimenopause because some days I feel like I am channeling my inner teenage boy and have that not so fresh feeling despite hygiene. Perimenopause, as you know, is a time of hormonal fluctuations. And if you're still menstruating, some months you're going to have higher levels of estrogen and other months you're going to have lower levels of estrogen. And these fluctuations can affect so many symptoms and most likely can affect our sense of smell. If you look at women when they're pregnant or around ovulation, there's generally a heightened sense of smell. So some of our changes in odor may be the way we're perceiving our odor through our sense of smell. Additionally, when we have our decreased levels of estrogen, this promotes hot flashes and night sweats. So in general, we're just sweating more, and sweat on our skin mixes with the bacteria that lives on our skin, and the bacteria like that, and they feed on this sweat and they make odor causing compounds, and thus that can produce a body odor. If you're a perimenopausal or menopausal woman, you can be sweating the moment you get out of the shower. I know for me, if I take a shower, I get warm. I'm trying to dry my hair. I'm sweating. You know, sometimes you feel like you're losing a battle. Then you're trying to put your antiperspirant or your deodorant on, but your pits are still sweaty. Additionally, because our estrogen levels are lower, the ratio of testosterone in our body to our estrogen is going to be higher. So we can see or experience things related to elevated levels of testosterone like acne, hair growth, chin hairs. If you notice, you get your little werewolf hairs on your chin. You also can have more sweat released from your apocrine sweat glands in your armpits and your genital area that releases a different kind of sweat that has more proteins and fats in it that the bacteria love to feed on, and this sweat can produce more of an odor. Also, as our estrogen levels decline, the pH or the acid-base balance on our skin actually increases, as does the pH of the vagina. And when this happens, we are less protected against bacteria in general. So as we age, we can have less of a defense against skin infections. And if you're experiencing some vaginal changes from perimenopause and menopause, you can get more bacterial infections of the vagina, but additionally you can just get inflammation of the vagina or atrophic vaginitis, which for some women can produce a bothersome discharge and odor as well. If you're experiencing this, you should see your gynecologist. But today mainly I'm talking about sweating from our armpits and our genital region and not so much the vaginal symptoms. Additionally, perimenopause and menopause is a time when our anxiety can increase, and this is very common. Anxious sweat produces a stinkier sweat because when we are stressed, our adrenaline levels increase, our cortisol levels increase, and this triggers more sweat to be released from our apocrine sweat glands, which are the sweat glands that produce that milkier sweat with the proteins and the fat that the bacteria love, and that can cause more of a body odor. Our second type of sweat glands are the eccrine sweat glands, and those are the ones that are located all over our body, and they open to the surface of the skin, and their main function is to cool us down when we get hot. So we get warm, these eccrine sweat glands release water, the water evaporates, and that cools our body down. This sweat generally does not cause as much odor because it's more water and less substrate or food for the bacteria on our skin. Now, there is a condition called hyperhidrosis, which is characterized by excessive sweating, and some people are born with this, although from what I've read, it's not super common. But then there are a lot of secondary causes of hyperhidrosis or excessive sweating, and of course today we're talking about menopause as one of those triggers, and that's related to the hot flashes and the night sweats. So just when we overheat, the perimenopausal brain doesn't like that, and we have a hot flash. And for some women, a hot flash means just getting warm, but if it's moderate or severe, then a lot of women are also, they're getting warm, and then they're having that sweating reaction from that process. You know, the sweatier you are, the more substrate or food you're going to make for the bacteria on your skin. Also, if you have night sweats, you could just be chronically damp, kind of stewing in your juices all night long. Other causes that can trigger more sweating would be drinking more caffeine, medical causes, having an overactive thyroid or an infection. Certain medications, like some of the SSRIs, some of the medications in the Prozac family, can cause some excessive sweating. So if you're struggling with this and you've tried some things and it doesn't seem to be getting better, just always keep in the back of your mind that it could be a medical condition and you should see your doctor to rule out other causes of excessive sweating. So what can we do about this? First tip is to hydrate. I think that's the tip for everything. Anytime anything's wrong, we just tell people they need to drink more water. In this situation, dilution can be the solution to pollution. Your body fluids are concentrated if you're dehydrated, and that can cause more odoriferous compounds to be released as you sweat. It's also a good idea to look at your diet. So if you're perimenopausal, menopausal, having a lot of hot flashes, reducing the foods and triggers for hot flashes, like reducing spicy foods, alcohol, caffeine, that may help. And then there are certain foods in our diet like onions, garlic, that when they are metabolized or broken down, that your skin can release these sulfur-like compounds that are funky. And some other foods like curry or cumin, that may cause your sweat to smell different. Excessive alcohol can cause your sweat to smell funky as well. Now, hygiene, I think we all know what basic hygiene entails, but showering regularly or bathing regularly, making sure that we are cleansing our folds under the breast, your armpits, your groin folds, carefully washing the vulvar area. You know, I treat a lot of vulvar skin conditions, so I'm not going to tell you to put antibacterial soap down by the vaginal opening. You want to be careful about scrubbing the vulvar area, but plain warm water and soft washcloth or hands, and you can use antibacterial soap on your armpits or in your groin area, but you just want to be careful with things that can be drying in the vulvar area. And it may sound silly for me to tell you how to wash your body, but apparently there was a TikTok that went viral from, I think it was a family physician that was just trying to teach people where to clean. You got to wash your folds. This is just basic hygiene. If you're working out, get out of your sweaty gym clothes as soon as you can and take a shower. If you can't do a full-on shower, there are some wipes that are marketed that you might be able to use, or if you want to use some gentle wipes and just wipe away some of that sweat, water wipes are 99% water and generally not going to be very irritating for most people. Now, hair removal is maybe not a controversial topic, but I'm not a huge fan of removing every bit of hair in your genital area, but there's certainly women and men that like to do that, and you know what, that's fine, you do you. I feel like overwaxing, overshaving can sometimes set people up for problems like boils, ingrown hairs, things like that, but a certain amount of hair removal may help with some of the sweating and odor, because the less hair you have, the less sweat that'll be trapped and bacteria that'll be trapped there as well. And of course, everybody knows that there are over-the-counter antiperspirants and deodorants that you can use. Antiperspirants generally contain aluminum that prevents the sweat glands from releasing sweat. And these aluminum salts plug up the sweat gland pores so that you release less sweat. And there have been rumors about aluminum causing breast cancer, but if you look at the American Cancer Society's webpage. They've looked at the data and they haven't found any clear scientific evidence that using antiperspirants containing aluminum causes or worsens breast cancer. If you're interested, you can go to their website, cancer.org, and check that out. Now, just as a side note, when it's your day to do your mammogram, you do not want to wear your antiperspirant or deodorant. And the reason why you don't want to wear that antiperspirant is because aluminum is a metal and a mammogram is a breast x-ray, and metals show up bright on x-rays. So when the radiologist is looking at your mammogram, they're looking for little areas of brightness or microcalcifications that can be a sign of breast cancer. And if you're wearing your antiperspirant, this may show up on your mammogram as a false positive. Now, deodorants don't decrease the amount of sweating. They simply target the armpit bacteria that cause odors. They may actually inhibit some of the bacteria. And then, of course, they're going to have a fragrance generally as well that can mask any odor produced by perspiring. Then there are combination antiperspirant and deodorant combinations. And if these things don't work, there are also available prescription strength antiperspirants, Botox some people get for excessive sweating, and there are some oral medications. So if you're really bothered by the amount of perspiration, sweating that you're having, you can always consult with a dermatologist about treatment options. The other thing to consider is reducing anxiety, because anxiety is a huge trigger for sweating and also for the stinky sweating. So when you are stressed, your body makes adrenaline and cortisol, which I alluded to, and that just triggers those apocrine glands in your armpit, in your groin area, which is going to produce that more complex sweat that the bacteria like to feed on. And so you will get more of an odor from that. And lastly, there are some over-the-counter products. They're basically some online products that are marketed for excessive sweating and for some of this kind of more intimate sweating and body odor in your armpits and your genital region. And I haven't used any of these products, so I can't say whether they're effective or not, but one product is Lumi, and that was developed by an OBGYN who kept hearing from her patients that they had an odor, but she never could find an infection or any other cause. And she basically developed this whole body deodorant, creams, sticks. You can always check that out if you're interested. Again, I haven't used these products, so I can't say whether they're particularly effective or not. There are all kinds of things online, and if you start, of course, putting in your search terms, then Facebook and other platforms will start showing you all these things. So I've had quite the interesting feed the last couple days. The last thing I wanted to add is that a lot of times, as you know, we are our harshest critics, and so we may notice a different scent or odor, and it really may not be apparent to most people unless someone is just right in your business. Anyway, that is my gyno bit for the day. I hope you got some helpful information out of it. I will see you next week. Thank you for joining me for today's Gyno Bits podcast. If you like this podcast, please like, subscribe, and share. Just a reminder that this is not medical advice and you should consult with your personal physician. Also, the opinions and views are mine only and do not reflect those of my employer. If you would like more information or to consult with me, please go to my webpage, healthiermenopause.com. You can also find me on Instagram at Healthier Menopause and Facebook, Menopause MD.